Good evening and welcome to part 3 of the Pet First Aid CPR webinar series. This is provided free of charge by our sponsor, the Celebration of Pets Foundation. If you missed part 1 or part 2, you can link to it, the video and Dr. Crowe's slides, by going to our website, www.celebrationpetsfoundation.org. This webinar series is consistent with our mission, which includes a major emphasis on education on any topics that ultimately strengthen the human-pet bond. Another major emphasis we have is we want to do all we can to help support our 8 nonprofit pet rescue beneficiaries, which I'll introduce to you again shortly. Although this webinar series is free, we really do need your help. So if you like this series and what we're doing, after tonight's presentation, please take a moment and go visit our website and make a tax-deductible donation, whatever amount you can afford. We'd just be very happy, and we really need it. And as a little extra incentive, Greg and I are monitoring our PayPal account, and anyone who donates $30 or more will get a surprise email asking your shirt size, so we can send you a high-quality shirt and cap as an expression of our appreciation and gratitude. Also, please tell your friends who are involved in pet care about this series that is available as a link to YouTube by going to our website. Now, let me acknowledge our pet rescue beneficiaries. Since our last presentation, we added a new one. At the very bottom there, you'll say Whiskers Project out of Blairsville, Georgia, and they offer a feline trap neuter relief service, which moves us up to 8 rescues that we're proud to support or help support. The other 7 include 2 no-kill shelters, that's Cast Off Pet Rescue in Blairsville and Valley River Humane Society in Marble, North Carolina, a pet transport service, which is Cats and Dogs Helping Hands out of Hiawassee, a trap and neuter rescue, another one, Feral Cat Service out of Warren, North Carolina, Lucky Paws Cat Rescue, a dog foster networking service, New Digs for Dogs. That's another way that we can help new pets find homes through a foster system, and also working in an organization that provides funds for spay, neuters, and rabies vaccination, and that's Operation Pup out of Hiawassee, and a working and medical service dog provider that also offers training and master's training course, which I think is a much needed career track for young men and women who are interested in working with animals, and specifically in dog training, but that's the Working Dog Support Network out of Blairsville. All of these nonprofits are fully on board and dedicated to help homeless pets and find them all forever homes and strengthening the human-pet bond. We just hosted a meet and greet earlier this week where we shared our plans with all the beneficiaries about our fundraisers coming up, our educational efforts, and learn more about each one's individual needs that we hope to help them out. So now it's time to introduce our fantastic speaker, Dr. Tim Crowe. First, I want to personally thank Tim. He's a very busy guy, and I know personally that he's been very busy this week because he came up Monday, just 2 days ago, and helped work on my dog, Gracie, and she had a very hard to diagnose and just a puzzle with an upper respiratory obstructive condition. And Tim was able to figure it out, and through his surgical expertise, offer a surgical procedure. And now she is doing really great. She's breathing with no difficulty for the first time in months. So that was not really planned. And then on top of that, I know Tim has been involved with working with Fetch 360, which is the organization that puts out the journal. And he's doing a presentation with them on hyperbaric oxygen therapy. So I know, so he's squeezing this in to, and we're really very grateful because he's a very busy guy, and his expertise is really appreciated. He remains very active in teaching and lecturing, and he's also self-employed, obviously offering a mobile veterinary surgery service. I mentioned him coming up to help me with Gracie. Well, he's been up here. He's helped 140 patients up here at Lake Chattooga Animal Hospital. I know he works for several other practitioners, and he greatly benefits from his amazing surgery skills and also the complementary diagnostic and therapeutic options he offers. Tim is double-boarded specialist, and he also has human medicine expertise and affiliation. All of his most noted achievements and accolades are actually listed in the introduction of the part 1 of this webinar, so I specifically like to refer you back to that because it's quite a list. And if you go to the website and go to the learning forum, you can learn more about Tim's background. But let me remind you that Tim is also a major pioneer of veterinary medicine. He has invented over 50 life-saving procedures, which I'm sure with more innovations to come. And to me, Tim is like the ever-ready bunny. He just keeps going and going. So staying with cartoon characters, and let me quote Porky the Pig, and that's not all, folks. The things I've mentioned, Tim is also a certified rescue specialist and firefighter and licensed as advanced emergency medical technician, where he provides emergency critical care services to people as well. Just an amazing skills. Consistent with his Christian faith and quoting the Bible, the good Lord made them all. So Tim has devoted his life to saving and improving the lives of all of God's precious creatures. Tim is a hands-on kind of guy, but he also shares his expertise through his countless scientific publications and lectures. As you would expect, Tim's work and career has been acknowledged by receiving many awards and accolades. But if you know Tim like I do, you'll learn that his family and deep faith is what most endears him, and that is what most inspires me. So on behalf of the foundation, I want to sincerely thank you all for attending. Thank you for your support. It's now my great honor and privilege to introduce again my great friend and mentor and our speaker tonight, the one and only Dr. Tim Crowe.
We had remember the last time in round 2 there, we had a horse in that picture too. And that little horse behind me is Babe, and of course that's my dear sweet honey Deb. And this is when we were living out in Nevada, and of course all creatures great and small. And that little horse behind me was severely mistreated when she was younger. And she was about 6 years old when she was the first time that anybody was able to get on her back. And so I was very, very fortunate to have the opportunity to do that. So tonight we're going to continue speeding up like horses here and talk about wounds, a little bit more on the review of bleeding that is so important. Of all the different things that would help save lives, stopping bleeding is very, very important. You don't know if it's going to be an animal or human where you may have to help stop hemorrhage. So I invite you to your questions too. As an EMT medic, I can also help field those questions there as well. So we're going to also look at serious wounds, some simple wounds, some puncture wounds, bite wounds, insect wounds, if you will, bites and so forth, burns, thermal, electrical, chemical. And then we'll get some time to talk about bloat and dilation of the stomach, which is just a large stomach that happens in dogs particularly, but it's even been reported in cats. Certainly happens in cows. The biggest thing we just have to always do on an emergency basis is, one, get them to your vet, but if you can't, and it's a situation where you can't do that, you may have to just decompress the stomach yourself. And that would be simply with a needle, and we'll show where to put that and so forth. We're going to talk about pancreatitis and a lot of the things we can do to help prevent it, because it's a terrible disease related to the inflammation of the pancreas. Hemorrhagic gastroenteritis, which is very common, especially in the summer, and that may be even more common as we get more and more dogs that are allergic to different things, including, of course, foods. It can be a food allergy, acute food allergy. It can also be related to a hemorrhagic gastroenteritis. It's usually due to a bacteria, or if it's a parvovirus puppy, it could be due to that, and they get severe diarrhea with that. Or we could have gastric foreign bodies that can also represent with the same thing, as well as hyperthermia. Dog can be trapped in a car, for example. Owner didn't understand that hyperthermia can also cause acute hemorrhagic gastroenteritis. And then, so we're going to talk about that in a little bit, maybe with some things about allergies, because some allergies do the same thing. They will also present with an acute hemorrhagic gastroenteritis, and there's some important treatments for those to do. And even yourself as the owner or as the person caring for the dogs, if you are training dogs, or you're working at a shelter, whatever you're doing to help those animals. It's just not dogs too, of course, it'd be other species as well. And we might then look into infrared light, near infrared light, and acupuncture, especially Governor Vestal 26. which is now, we know that acupuncture is related to light, and light activates, of course, the acupuncture points, and it's really helpful. So this is a little movie film. I'm not sure it's going to show up or not. There it is. There we go. So this is a laceration in the shoulder groin, actually the groin area of a pig. So it is, this pig is under anesthesia, and they are trying to show how medics will care for injuries like this in the military. That's where a lot of things have been learned, unfortunately, is in war. And so this is to mimic that. So we have, when you see that, you'll put a pack on it right away. You'll add a dressing. You'll put more pressure on it. Just more pressure, more pressure. You will immobilize the limb or the part of the body. And then you'll add an acupuncture point right at the very, very bottom of your foot. And I know that just to take in time, I'm going to just bring out little dog here. So the bottom of his front foot and the bottom of his back foot. And those are just right at the very bottom of the paw are K1. And K1 does help stop bleeding. And it's been known, of course, by the Chinese for those years, hundreds, millions, not millions of years, but thousands of years. You know, at least 5,000 years they've been practicing acupuncture. And they didn't really understand why, but it interacts with the body. We'll go into that in a little more detail later. You can use a hemorrhagic gauze that's made of chitosan, and it's these are available on the internet, and it's a good idea to potentially have that in a first aid kit. We're going to spend more time talking about what should be in a first aid kit next time and how to use those things that are in it. And then, of course, treating shock. Well, we keep them warm. That's important. And drive with wound basics, if you will. And drive to where? To your veterinarian or to your emergency clinic. If you can, get there in a timely fashion. Otherwise, you may end up having to, again, wait until you get out of the woods or wherever you're at and continue with this type of control with head hemorrhage. Because you can literally die within just a couple minutes. You can be to the point where you lose your blood pressure so fast. And this is including, of course, a person as well. So it's immediate pressure right over the area. And we'll talk a little bit about tourniquets later. But it's the pressure that's the most important. Or you pack the wound and you keep on packing. You pack it so well that you get it done. Okay, so that's about it for that particular. Now, so let's could be a guy right here who's got a, a bad injury here at his radial artery, and so he's trying to hold pressure, but it's getting worse. Can't really control it, and so you could put some kind of occlusive material around the front of that where the vessels are injured. And then apply pressure, certainly apply dressings, and then apply a tourniquet. I would never use a piece of wire like this, and it's very narrow. Always use something larger. I got this off the internet. I saw this, I said, no, you would never want to use a piece of narrow string material, wire, or anything like that, because it causes neurovascular injury up above the area then, and that can then be a worrisome problem for the whole limb. While I'm sharing this with you, this is, of course, this is some chitosan, this celiax here, which is a hemorrhagic, kind of a hemostatic agent that is in the gauze material itself. Vet wrap, which I don't have a picture of, but works very, very good, and most of you know what it looks like. It's just elasticon like material, and it's very stretchy. If you put that on and you wrap it on, and you wrap it, for example, I'm just going to bring this little guy here, and you wrap, this is a limb, and you wrap around the limb once, twice, 3 times, 4 times, 5 times. Every time you wrap it, it gets compressed more, compressed more, compressed more, and that acts like a tourniquet. And that is, of course, to only stay on while, of course, there's that active bleeding. When do you not keep turning it? Is when you notice that the bleeding doesn't happen anymore. Fortunately, in most dogs and cats, and most large animals as well, a tourniquet is not something that's generally necessary. If I use a tourniquet, I use them, but I like to use them with I'll just call them a blood pressure cuff. You can get a blood pressure cuff for probably $20 or $30, $40, and it'll have a really wide base to it, and you can double it up or fold it over on itself and use that, and then put some tape around it, and then squeeze up the dial on, of course, the manometer, which is going to put air inside the cuff, and that's going to compress, of course, the limb, and that's a much more gentle way. And there's been some research to show that these can stay on for like 3-4 hours because it's such a very gentle way of compressing the arteries and the nerves, veins, all of that structure together. And then when you're done, you don't need it. You got the whole way you come to control. Then you gradually bring this device off. You let the air out. You have to put a clamp across it or pinch it to keep it from the air in it, because it evidently has a chance to leak otherwise. But you'll put a clamp across it or pinch it up near where the air is going in. And then, of course, we can just use some gauze or materials to actually make a tourniquet as well, where you'd lay that around the limb and put a turning device within it, of course, to like a fulcrum to turn it until you see no more bleeding. And then, of course, then you would then keep it there with some tape or another piece of gauze or something to hold it there. You write the time you put that tourniquet on, and then you basically then drive. It's important. You don't take it off. And the research shows that tourniquets are really a very, very, very life-saving thing for humans, but not as much as the needs that needed in dogs and cats. So where do you put them? Of course, in this drawing, you can put them, let's say if there was a very bad bleed and then you couldn't get it controlled, you could put that right above where the bleed is, away enough so that you can get this area clipped and cleaned and all that later, because you're not going to remove it. So just up above the area where the injury is. And again, most of the time with dogs and cats, you really don't need a tourniquet. The place that I have used them the most is on the tail. I've used more tourniquets on the tail than I have anywhere else, because it's really helped stop the bleeding right away. And now the dog's tail is more immobilized now, which is part of the whole thing. And then you can put a bandage on it and all that. And then you can take him to the operating room, even with then the tourniquet still in place. Then you find where the torn vessels are, and then you can pinpoint where those are much better. So I use this as a surgeon quite a bit. Obviously, you can't put it around their neck. That just won't work. And of course, up high in the groin will work as well. But if it's an injury that's deep into the groin wound, way up into the area of the groin or something, then you know, we've talked about this before, you can't use, of course, a tourniquet up there. A wide vet wrap application, like I mentioned to you earlier, works very, very good. Works excellent. Of course, works very good because in multiple layers it gets tighter. It's like an Israeli bandage. Applying a compressive dressing. Here we are compressing, let's say a wound. This is on a dog pedican mannequin. And we put the time on it as well. And we would like to be able, this is so important, whenever you're applying something to stop a bleed, make sure you're not stopping all of the circulation to the limb. We just had one recently where somebody put a really tight bandage on a toe of because of a bleeding toenail, and then it was a bleeding toe. Of course, it had ripped right there at the base of the toe and the nail, and that dog lost part of his limb because they would put it on so tight, and they didn't take it off, and they left it on way, way too long. And poor little guy did have some reconstructive material, things they have done to help save part of his limb, which he did. but it can be very concerning, though, that, you know, you cause the problem then by trying to help your own dog. All right, so and again, if it's down in the groin or somewhere like that that you can't get a nice bandage on, or like something to really push and stop the bleed and compression, you can then deep hole and lacerations, put the gold, just pack the hole with a wound, pack it with all kinds of gauze, just pack it in there and keep packing till you can't pack anymore. Then you'll put the dressing on, put a wound dressing on, and keep the wound clean, prevent further contamination. You know, wear gloves if possible. Wash your hands, of course, prior and after, and of course use some hand wipes if you have them. But, you know, you're in an austere environment, you may not have all those things, but you do as best as you can. And cover it with a sterile cloth or material. But if you don't have it, at least try to use with a clean cloth or material or clean dressing. You know, it happened this one time. I knew a fellow that had to take his own shirt off, t-shirt, and pack it into a wound to help stop the bleeding, which he did. Stop the bleeding, and then that was a really important thing to do. So, you know, you can use towels, gauze, pieces of clothing, even pieces of plastic or plastic wrap. You can just stuff that in there, and even bubble wrap will work as well. This is a wound that you want to make sure that when you see this wound that you irrigate the wound out. You know, just you can use tap water, simple tap water, to irrigate out a wound that's really full of material like leaves or you know, road debris, whatever. Just irrigate it out. Now, it's important to do that, if you can do that, is have the dog controlled or the cat controlled with a nice something covering him, so he's not going to try biting you. Remember, we do that safety first thing. You always take control, because that's going to hurt. And you can imagine that. Things that you can also put into a wound to help keep the bacteria population down, it's just amazing, are things like, well, not so much KY jelly, but it still has chlorhexidine in it a little bit, hydrogel, honey, sugar. Imagine just table sugar being used in a wound. Here we're using a product called Technicare, and it's chlorxylenol and aloe vera. And it's the only surgical scrub that I know of that is applicable to put directly into a wound. Here was the end of this guy's tibia. The rest of his tibia was turned around the other way. And then here we put it back in place. So it's now got, you know, you can't see the end of the tibia any longer. And we put it back in place, and we just got a surgical scrub here on the wound directly. Well, I want to make sure you understand that this little stuff is not just, it is the only product that I know that you can put it in directly in a wound. And here is just one of the jars of it, or bottles of it. It costs around $40-some just for one of these, but it really makes a difference when it comes to wounds that are heavily contaminated, and hopefully they won't become infected. So if you'll notice here on this bottle, it says right here, non-toxic. It is the only product. It's a surgical scrub. And others, if you even get in the eye, it can even cause major eye damage. This one, no sir. But at the same time, you'd still irrigate after you put this in for a bit. It kills all within 30 seconds. It kills 99.99% of all the bacteria, because it also has tris EDTA in it, which gets the gram negatives, and it does. And the aloe vera, of course, is going to be an anti-inflammatory as well. So it's a very, very good product, and it's by CareTech Laboratories. And again, it's non-toxic. And here's a phone number if you can't read it on the bottle and you want to write it down. It's 800-325-9681. And it's caretechlabs.com. And they're very just good about working with anybody to get this into their hands. The other thing that you can use is water that's passed through electricity. This is called electrolyzed water. And it's two kinds. When you pass through electricity, it makes an oxidized water or a reduced water. The reduced water is a higher pH. The oxidized water is a lower pH. Here we are in one of the practices that I did many years of practice there up in Chattanooga, Tennessee at River. And here we have the water machine hooked up. And so all it is it's a giant electrodes. Two electrodes are within the machine, and then they separate the water into an oxygen or a strong hydrogen water. And so here it's hooked up to the machine, is up to the faucet. These are available. Many people in Japan use these. So the pH of the water, which is basic pH or has strong hydrogen ions in it, this is the water that is very good to clean the wound. And then this is the one to help purify the bacteria, to get rid of the bacteria or any viruses or fungal agents. They use this as a particular agent in an actual product called Vetricin that's available over the counter in many feed stores and so forth. You can buy it. Or it's on the internet as well. And it is this type of ionized water that has a lot of hydrogen, a lot of oxygen in it. So it uses a 220 watt powered transformer, and it's got 7 platinum medical grade electrodes in it, and it ionizes the water. And this ORP is oxidative reduction potential. Anything with 1,000 like this is going to kill bacteria, viruses, but not hurt the cells, because the cells have superoxide dismutase and catalase, and they can just say knock off, if you will, the oxygen radical part of this ORP. And so that's why it can be used in wounds. And I know some really good wound doctors on the human side as well that just have the most difficult wounds, and they have these people come from all over to be able to be treated. But this is now available for you too if you wanted to get an ionizer. Again, it also penetrates into tissues better because it is a smaller molecule of the water. It breaks it up. You can apply it in wounds. Again, it's bactericidal. If there's a lot of exudate, let's say a wound is just really pussy, or it's really, you didn't see the dog, had been away for 2 days, and now he comes back and he's got all kinds of junk coming out of this wound, including maggots or things like that. Please think about using electrolyzed ionized water. And the pH here you would use is the high pH, and you would break up that mucus and so forth. It gets rid of the biofilm very nicely, and there's a lot of good research done about how good this works for wounds. This is one article that was published now 21 years ago in the Journal of Trauma that they looked at. This was published, the effectiveness of electrolyzed oxidized water in the irrigation of burn wounds. And these are a burn wound model. So pardon me, but what they did is they took Sprague-Dewey rats and they anesthetized them, and then they caused a burn on their body, over 30% of their body surface. And then 2 days later, after they seeded these burns with Pseudomonas aeruginosa, very bad organism to have a burn. And then they just, of course, followed through with these fellows here. And of course, the survival rate was significantly higher with the rats that were irrigated. Their wounds were irrigated with the electrolyzed oxidized water, and compared to saline. And then, of course, in the control group, they didn't do anything for those wounds. That's a fairly poor model as far as I'm concerned. I hope they did good. Did good pain care of these little guys. But the electrolyzed oxidized water then prevented even burn wound sepsis. Saline didn't do that. So even irrigating the wound, what you'd think would be the best. So you can pass this on to anybody who has severe wounds, the idea, or has somebody that may have a severe wound that gets it across all species lines. So the other one is want to bring out is real easy is granulated sugar. And you just take it and put in 1 to 3 tablespoons, and you can put in some glycerin to form a little peanut butter solution thing, or you can actually just pour the sugar straight on into the wound. Then you change that sugar dressing. Let's say you're out camping and you're long ways away and you can't get back in for several days, and it is very important to wash out the wound periodically so that, as you know, the sugar is going to attract flies. And you want to be able to irrigate that out. But at the same time, it's very, very, gives you an example. Have you ever seen anything grow in a sugar, a container of sugar? It's out on the coffee table or whatever. So the sugar bowl is right there and nothing ever grows in it. If you ever see something growing in sugar, will you please write to me or let me know? Because as far as I know, it's not ever, but it's got to be just plain old sugar. Of course, you can also, again, rinse the wound out with either water or saline, or now you know about electrolyzed or oxidized water. Electrolyzed oxidized water, the EO water, it's got a pH of 2.5. It does not hurt the wound at all. And then you irrigate that out, and then you'll put more sugar in there, dry it out, put more sugar in there, and apply it. I had a story of some missionaries that were over in Africa that were medical doctors, and they took a veterinarian along with them, and the veterinarian knew all about sugar. And this one lady had a really bad wound, and he said, "No, we don't have to amputate her leg. Let me take care of this." So he just turned the lady's care over to him, and they just happened to have sugar, of course, in in the mission area, and she healed up. She healed up really, really well, and sort of that really taught the medical doctors a lot about how sugar helps with wounds. So here I am pouring. This is a little dog that's got a very bad infected wound. And it's a really great thing for infected wounds. If you can't do anything else, you can pour in sugar. You'll irrigate out all the yuck you can first, pour the sugar in, and then you'll then bandage that up. And this goes on to, here's the bandage on, and here's a loop. And this little loop is really interesting. This little loop I'm showing you here sends out a signal. And it sends out a signal, it's like a radio signal, and it increases blood flow and decreases pain far better than most, at least over-the-counter pain medications. And even some of the bigger pain medications, they were able to show with humans now, it dropped their need for pain of the same amount by at least a third to a half, just by using this little guy right here. And we just turn it on, and it sends out a signal, and it's also increasing blood flow. As we speak right now, it sends out a signal at least out as far as 6 to 8 to 12 inches on both sides. And so here we are applying it right over her neck area, her head. And so that she is getting them treated along that whole area. And literally she's fallen asleep with some of this because she's in much more controlled. And here's the wound starting to look a little better. There's the ear canal right here where there's a really bad wound that was there. And it went on to heal. I'm going to go back a little bit. I'm going to go one more back at the previous one. This is showing the staples that are in place. Now, it's a good thing to carry in your emergency pack is staples. Have one skin stapler, because if it's a really small little laceration, and if I draw a little line right here on the dog's head, and let's say there was a small little laceration that was about this big and it's very clean, and it looked, you got it really fresh, you may then be able to squeeze the tissues together and then use the staple gun to just kind of fire the staples in, just like you would be closing a piece of paper. And those skin staples are, yes, there's going to be a little pain with that, so that you will be able to use some acupuncture points. One is Governor Vessel 20 right behind the ear, and that works really good to help calm. And then there's Governor Vessel 20, large intestine 11, which is right at where the angle of your arm is, and that really helps then with pain as well. So those activated. And I can tell you stories about where I was going to do some veterinary work at a mission, again, mission work, out on an Indian reservation. And we were doing some surgery, and the dog was getting uncomfortable after surgery. And I went over to him and used the acupuncture points, and the dog went to sleep. And the lady who was having all the drugs said, "Well, how did you make him go to sleep?" I says, I just pushed these points, and it made him help them asleep. Not always does it do that, but it really helped him a lot. Okay, honey. Here's another one you can place on a wound. And again, this is if you're in an austere environment somewhere, but you got your little bottle of honey with you. It's got an acidic pH. It does do a lot to help arrest and inhibit bacteria that are growing because it's got some antibacterial properties. It helps prevent the growth of the bacteria. It also controls the free radicals that the honey just is absorbing, the free radicals, which are, they're let's just say the bad guys of where there's this injury to wounds occurs, because it's got an antibacterial peptides that are in there, and it works really well for that. So that's the same thing, though. If you put the honey on, you certainly will attract flies with it. So you must make sure that when you cover the wound, it's going to be a sticky mess, but make sure that you irrigate that out. If you're, let's say, out camping or something, you can't do anything about that. So if the wound is located where there's going to be a bend in an elbow, or in this case, the carpus of this dog, and you know that it's going to be opening up and closing and not doing well, and of course it's not going to help with bleeding that way either, then apply a newspaper splint after you cover this wound up with, of course, cleaning it, irrigating it a little bit and covering it. And then, of course, apply, a newspaper splint of some kind. So even though it's a tough wound, it may look very bad initially, there can be some very good outcomes that are happening. With this dog is just an example. This is now back in place, and this is after we irrigated and cleaned everything out. And of course, we had to do some fixation with some external fixators to make this all work well. But here he's getting his little seed grafts put in we're taking some grafts, some skin from here and moving it into there. And then this went on to heal. This is the surgery he had. He had ruptured ligaments around his hip, so he had his hip out. And then, of course, this is what we had to do to fix him, is to put these external fixators back on. But that's what it looked like, pre-operatively when you saw the end of it. And this is Louis afterwards. And he's just a good example of how hard work with wounds can pay off to help save both legs in this case. And a lot of happiness here with the owner who loves his dog, and of course all the team that were helping care for him. This was a little earlier when he still had his fixator still on, and he just loved his dad. And his dad, of course, this is the human-animal bond that Dr. Burr is talking quite a bit about all the time. All right, so hey, what about this? Fish hooks. This is the time of year, a lot of people going fishing. First of all, prevention is the very most important thing. So if you're catching the fish and your dog's behind you, you don't want to just pull that fish up and then let it go over there where the dog is. The dog and the fish may meet, and you might end up having something like as sad as this, is where there's a double hook here, and he's got a lip gets pierced on both sides with this hook. Easier, simple, and done if it's only a single hook, but a treble hook or a second barb hook, so you gotta say, well, what can I do? Well, the best thing for you to do is, first of all, two things. Never pull on the line. Never pull on the fishing line, because that hurts. One, and if it's down in his throat a little bit, boy, it can really make a lot of injury and worse. And then, of course, if you're out in a wild environment somewhere and you're by yourself with your dog and you're carrying some tools with you, it's important to do that, but be careful. You may end up having to then put on some glasses. These are just like safety glasses in case as you are taking and biting this thing off. And where would you bite it off? Well, you've got to have the barb sticking out, and then which is right here, and then it's going to be cut across right there, and then you got to have something to hold on to it too. And how you're going to do this by yourself? Well, a couple of things. Again, use the acupuncture points behind the ears. Use this is important to do if you're going to have to try to get this hook out yourself. Otherwise, if you've got to hike 10 miles from the river you've been fishing, you should think of just covering him up in a towel and hiking those 10 miles, because then it can be done quite a lot better, if you will, by sedating him first. Okay. Here's just a scenario then. Let's say you're on a river, you're camping, and you're 10 miles in on foot, and you've been fishing, and you pull that fish up and back, and there's your dog, and he decided that he liked the fish too, and now you got a mess with a hooked fish and a hook in the dog as well. So these are the steps, of course, to do is, of course, wrap the dog in a blanket or something first. Don't ever pull again on the line. You know, cut it off. You know, then when you're looking at where he's hooked, where is he hooked? Is it a paw? Is it in his lip? Is it near his eye? Wherever it is, you may have to leave it. Let's say if it's in the eyelid or something like that, you're not going to get that out. You're going to just hike and hoof your 10 miles, and that's what you'll have to do. All right, so I was going to do a demo here of removing a barb in an exposed situation, but I think I'm going to be running out of time with all that I have to cover. So the idea here is, though, if there's a barb stuck inside the tissues, you're not going to be able to remove it, and the dog's really not going to let you do that either. And if it's swallowed, if the dog has swallowed the fish hook, then just cut the line several feet away. Never pull on the line at all. And you'll have to transfer him to your vet. The dog will have to be anesthetized, more than likely, to get the x-ray, but he may only need sedation. But make sure that no one's going to tug on that. And then once then, they'll find out where the location is. It could be in his esophagus. It can be in his stomach. You know, and unfortunately, it could be anywhere. It could be just on the base of his tongue. That's a lot better. But you won't know. If it's a treble hook, it's certainly a lot worse for everybody. And he may even have to be referred if he's got, let's say, it happened to me once where I had a dog's hook that went through his esophagus and was near right where the bronchus comes, where, you know, you are breathing through these breathing tubes. Well, your esophagus passes by there nearly, and the hook went right into the area near the bronchus. That took a chest surgery to take this guy, and you know, it couldn't be done with endoscopy. It wouldn't come out. We had tried a little bit, but we had to do a thoracotomy to get him. So I always say, people, have insurance. It's a really good thing to have in this situation. Let's move on to bite wounds now. Okay, dogs will be dogs, and they do like to just tear everything up. First of all, don't try to separate them at all in that fight like this, because that can happen. You can end up having a very, very bad bite injury. Happened to one of my friends who's a medic with me on the fire service. And so she said, oh, I should have never have grabbed the dog's collar, because then the other dog reached out and grabbed, because they were in this frenzy. They don't know what's going on. So this ready whip is a great way to separate dogs that are fighting. So maybe that's a good thing to always carry around in your refrigerator a little bit, is a little ready whip. If you don't have that, you know, you can use water, just spray with a garden hose, for example, you know, and then you got to think about, now these dogs are apart, you got to keep them apart. And now you've got, well, you look over the dog, or a cat, can happen to cats too, of course. And we have this thing called tough hide. Both the cat and the dog have a lot tougher hide than the tissues underneath. So you really can't tell how much injury there is. You can have a small little puncture wound here or one here, and you go, oh, it's not bad. But the crush underneath, you really can't tell. So first, safety first. You make sure that you, when you're doing all this stuff with your dog, is that the dog will calm down again. If he's still all excited and everything, or the cat is, you got to wrap them up, you know, like a burrito, so you will be able to take care of them that way. Preventing further injury means further covering that area up. So let's say there was a big bad hole over here, and a little hole here, and over here another hole. And what you do is just take a towel and wrap a towel all the way around. So you now have it covered. At least then dirt and things from the ground or whatever aren't going to get in there any further. It's still going to be a bad wound, but you're covering it, and then you're seeking the help to that veterinarian as fast as you can. So best emergency treatment for bite wounds is seeking the veterinarian, the medical established people that are there to help you as soon as possible, because as the little punctures go in, your bacteria in your mouth are up to a 10 to the 12th bacteria. And that's around the sockets of your teeth and all. And that's the same way with a dog. That's about the same kind of bacterial population you have on the other end at the anal area. And so you'll know it's like putting feces inside a wound when that bite wound occurs. Think about it like that. It's not something to think about nicely, of course. So this crushed tissue is the other thing, is that you don't know how much there is unless you have an investigation of that, which means we lift up the wound, for example. We do this in the hospital after we knock the dog out enough so we can see, or the cat, and then we see if there's a tunnel. If there is a tunnel that connects from here to here, you know that there's a lot of, we'll call it, pulled tissue away. So it's physiologic degloving, if you will, of the skin versus the tissue underneath, set up for a bacteria to be in there. So sometimes it's very deep and it needs immediate surgery. And sometimes if you get air bubbling around something, especially a chest wound, you know that there could be a lung that's been injured. You may see a little bit of intestine sticking out or something like that. Cover those wounds up so that intestine doesn't come out. If you even think about it, there could be. Wrap the whole abdomen up in a towel so you won't have any of that potentially happen, and then carry him carefully so that you're not going to have him jump down out of the truck, you know, at the parking lot, and then all of a sudden that little wound is now split and all of his intestines come out. Not a good thing. So the outside might not look so bad, but the inside might look like hamburger. That's what happened to this wound. This wound is this wound. And we were removing some of this tissue in here, and it just looked, this is after we were actually working on the wound a while, but it's crushed up muscle. So you don't see the black hamburger-like muscle now. It's getting cleaner, looks better. And then we'll be able to close and irrigate and close, but not if it's still hamburger all the way down to the deep as part of the bones and stuff. We put packed sugar in there, and we don't close it. We leave it. We only close it if there's all the dead tissue is gone. So here we are working on that particular dog who is a kind of a big shepherd-like dog who got bit in the abdomen and all around his areas. And here's two docs working with headlights on, and of course the dog's on a ventilator. He's got all the paraphernalia for doing with anesthesia and all that, and we're just working well because we have a lot to do to do well. And this dog did do well, even though he had quite a bit of significant injury and had to go into the abdomen as well. So here's some examples where they needed exploration. Here's a bite hole in an intestine. That would not do well if that got missed, if you will. And here's a bite hole in a lung, and that won't do well either. And then here's a little Yorkshire Terrier that was bitten by obviously a larger dog. And this is a broken rib caused by the bite on the chest wall. And then either that or the tooth itself went in and did it, and then the holes in the lung itself. So the hole in the lung is a hole here, a hole here. And so there's a little video there, watch.
The bubble. Tore right through here, tore through here. He's bleeding. The bubbles are going right through here. Here's where the hole is. So this is getting this one hole here. Yeah, but that's bubble through there.
So we had to remove, of course, that lung lobe where all those holes were, and then there were other little holes that we just had to sew up. So we know that these wounds can go deep, and then they can cause this problem, that's for sure. I'm trying to move on to the next slide here.
Okay, there's bubbles.
And I think you've had enough of the picture of that bloody hole in that dog's chest. I'm trying to move on here, but it doesn't want. Oh, it doesn't want to go. All right. All right. Let's see if I can move along here. You know, you can tell. Hey, good thing I'm a surgeon. I certainly wouldn't be very good in the movie industry. That's for sure. Yeah. I guess not. All right. Now we got. Yeah, you can see them both sides here. All right. All right. So don't delay in seeking the care. Immediately go for it. You know, a delay increases the chances for serious complications, requires critical care, 24 hours, things like that. We're talking hundreds of dollars here on a patient that has a bowel that's been ripped open. There's an abscess and a peritonitis and so forth. And this is a dog, we couldn't even close his abdomen because of it was so bad in there, we had to just make it like an abscess. So that's very important. So all this intensity takes a lot. And we've had cases where it's been thousands of dollars and then sometimes they don't even make it. So it's a very, think about it this way. You'll guard your wallet as well by seeing somebody very early and then he needs bite wounds. Don't wait. You might think it looks not too bad, but then the next day or two it's looking worse and you don't know because you got all the hair over it and it's matted. You won't see it, but seek that care immediately. Even just less than 24-hour delay can make a huge difference. Every time an hour goes by, the bacteria that's been seeded in there by that bite hole go up by one log. And when you get to 6 times, which is 6 hours, 6 logs, that is an infected wound. And because of all the different kinds of bacteria in the mouth, this becomes like a gangrene rapidly. And then we can lose the limb or lose the dog, essentially. For example, this dog was, unfortunately, that it was a bite wound 4 days previously. And they called me in to do some surgery for this dog. And that's the inside of this wound. And that's all gnarly, dead like hamburger. And that dog was severely injured. Let's move on to snake and spider bites, because that can also sneak up on you too. Yes, they can have an allergic response to that as well. But from the standpoint of the snake or the spider or the hole that's being made, those can also, because they use that venom to help digest what they're eating, it's going to help digest, of course, the muscle and the skin underneath and everything. And these need to often be clipped up. So if you think your dog may have gotten a bite or something and not acting quite right, seek medical care. You may not have the clippers there, but if you've got clippers, yeah, you can, wrap them up so he's not going to bite you, because these kinds of wounds can hurt really a lot. They're very, very hard to handle sometimes. So, but do the best you can. If you can't see a vet right away, do the best you can by parting through the hair. If you have clippers, try to use it. Put a muzzle on the dog if you need to. Be really just gentle about the whole thing. Use these acupuncture points to help you as well. There's like Governor Vessel 20, large intestine 11 right there where the elbow meets on the front part of the elbow there. Do not lance. Don't apply suction. Do not apply a tourniquet. Don't apply ice. Don't apply heat. Don't apply electricity. I've even read some places where people have applied electricity to their dog as a 12-volt battery. This is not good. I would highly recommend you just put the animal, if it's small enough, put them in a little box and cover the box up and dry. Your best true tool you have is your car keys. Okay, transport them. If it's a really large dog, just create the dog or put him in a blanket. If he's collapsed, make a makeshift litter out of a blanket, for example. Remember, the pain can be intense. So that as you're working with the dog, and if you move where he has gotten a bite, that can really cause him to want to bite. Also watch their airway. If they're bitten in the tongue or their mouth, that can swell up significantly. So you don't want them just dilly-dally around. You want to get in. So here's a treatment that's made a difference for serious envenomations, both on the human side as well as the animal side. This is a dog who's in a hyperbaric chamber. He's looking right straight out at me here. And we use hyperbarics because it takes the swelling down. We put the anti-venom in first. Then we get that good started, and we give him some fluids. And then as soon as he's gotten some pain control, and then some antibiotics, and then he gets into a chamber. We do that early. And we have low pressure chambers and higher pressure chambers. And these supportive care, some people will use steroids, but and the antihistamin's a question mark as to what it does. Another one that they've done a lot of work in Brazil on is using, they have a lot of poisonous snakes in Brazil and of course in Australia, is they use a red light therapy or laser therapy. And that increases blood flow and decreases pain, and it denatures the venom of the snakes and that they've got there. And I would imagine there needs to be crossover as well. And sometimes as a surgeon, you have to remove the dead tissue if it becomes necrotic. All right. So let's go down to burn wounds. If you see a burn that occurs immediately, cool that burn right away. Try to do it within seconds if you can, or a minute. But, you know, and then do it for 30 minutes. Even a delay of 30 minutes has been shown to significantly decrease the burn severity, because as that fire or heat, let's say it's a scald on a stove or something, it's still burning, and it burns for at least 30 minutes. It continues to burn. So therefore, make sure you get it cold. Cold water, cool water. If it's over the whole body, we recommend not putting the dog straight in some ice water or anything like that. He'll get hypothermia. We'll talk about that next time. But you'll cool him with cool, tepid water, and that really decreases the burn significantly from a second degree or third degree burn, even to a first degree burn. I just had a little burn on my hand the other day from doing some work on the with a grill, and I go, as soon as I got the pain, which is, there's nothing like pain that's caused by a burn. Well, get yourself into that cool environment underwater right away, soak that hand, whatever, and then the dog, if it's his paw, get him into that water and leave him there 30 minutes. Because that really takes care of the burn a lot in terms of decreasing its intensity. Yeah, and it can be done gently. You don't have to use a fire hose to do it, but you know, it's just an idea. So the causes of severe burns in dogs, of course, would be hot liquids, hot foods, heating pads, flame or fire. Heat lamps are very good, very important to watch those. And even if you've got a sick animal that's on a heating pad, they can get severely burned because they can't get off of it, and it continues to burn. So hair dryers, we've seen those, and scalding water, and of course engine mufflers, anything like that that's got a hot surface like it. And this has happened to be a dog who was in an explosion caused by gas cans in a fire situation. And he wasn't the only one. There's a whole group of these dogs that were in this situation. So we do know that the burn wound is, of course, very painful. So that's another part that we've got to carry for the pain that's happening in these burns. So these are the burn types that we have. Of course, these are the thermal burns. And says, so if you place the part in the cool waters we talked about, that could be any kind of burn, electrical burn, the thermal burn. If it's a chemical burn, you've got dry chemical, try to get that dry chemical off first. You know, again, you probably want to do this. You want to put protective eyewear, cover the dog's face up and head, and then you put your own eyewear on there before you brush anything, because that can be quite caustic. And so a thermal burn you might not see much initially too, because it's covered with hair. And the hair just kind of like, it's burned underneath, but you can't see it. Like this was a particular burn that was hard to really see where it was until we get all the hair away, okay? And here's an electrical burn. And there's a different area that looks kind of unusual. And the history was the dog, they heard him screaming, and then they saw the electric cord. And of course, these guys go into pulmonary edema. They can get severe pulmonary edema and have a lot of fluid that runs out into their pulmonary space, into their alveolar space. And then they can get into trouble that way. So sometimes we even have to ventilate these guys. But it's kind of more common in the mouth, but we've seen them in lips and tongues, and especially puppies that bite electric cords. So be concerned with all your cords and where your puppies are, and your kitties too. They can bite on things just as well and get an electrical burn. All right. So this is the new therapy. We've got chambers that will go up from about 1.3 to 2.5 times the atmospheric pressure that we are living in right here. And this increases the amount of dissolved oxygen in the tissues. You can imagine the higher pressures, more dissolved, lower pressures, not as much. But it improves healing, decreases pain significantly. I've been in a hyperbaric chamber myself from a bad wound, and it helped me save my leg. And then the doctor who was taking care of me said, I got to confess with you, I had somebody that didn't get into hyperbarics like you did, and she died. And so wounds can, by having an infection there, it reduces the swelling, which helps the cells then get more oxygen. It helps improve the elasticity of red blood cells and the white blood cells. The red blood cells work better. They offload their oxygen better. They can move through tissues easier. And the white blood cells, of course, they essentially work better. They get revved up in terms of their ability to function, like especially a large white blood cell called a macrophage. And then it lowers the rates of viral and bacterial infections, because it even works again to help is almost like a viricide or a bacterial because bacteria, a lot of the ones that cause infections are kind of like smoldering. They like to live in a manure pile or microaerophilic. So it reduces platelet aggregation as well, so you get less clots in small tissues, and it improves the function of neurons as well in injured tissues and ischemic tissues. And think of the wound might be a brain injury. Let's say it's a traumatic brain injury. Well, that's a wound. In this case, it's a wound in the brain, or it's a wound post CPR. It's a major wound of the brain because it's all edematous from the CPR that wasn't maybe doing as good as we probably could, or a drowning or something like that. So hyperbarics has got a very good thing it can do. Here's a one that goes to 2 atmospheres, and so they'll get about 1,520 millimeters of mercury. And on the gauge little pressure here is going to read 14.7, and you're in there an hour. And then, of course, it helps. Of course, there are areas in the body that really will also absorb this oxygen, and it actually makes you a lot less painful as well. So it's significant less pain as well. I just did this once to show you what I was just kind of kidding around once. I had to take a bowel out, a bowel obstruction patient. And so this is the section of bowel that was all, dark in color. You can see it's kind of a bluish color. And I just left, so that's before, and I just took that piece of bowel and I put it into the hyperbaric chamber, left it in the chamber for a half an hour, pulled it out, and then took another picture. I think you guys can see that was kind of bluish, and this is more pinkish. And that's in body tissues that aren't even circulating, because the oxygen diffuses into tissue. That's how you get your oxygen. Of course, you need your red cells too. But if you have really less red cells for shock, you can use the hyperbaric chamber for that too. So here's the mild chamber. Here I am in there with a dog. He had a bad spinal injury, so it's a different kind of wound. It's in the spine itself, and it's an anti-inflammatory exciter of genes, and it decreases the pro-inflammatory genes, about 850 at least. And so here I am, and kind of taking a little nap with my friend, and we zip the chamber up and we give the chamber the oxygen and air inside of it. Here's a little baby lamb that was 4 days premature, and she had severe pneumonia, and she had a lot of edema within her lungs. And so here she is zipped inside the chamber, putting her in there, and then she's zipped inside that hyperbaric chamber. And then here she is Oh, this is such a story. So she was born on Easter week, and so her first name we gave her was Grunt. And I did a farm call on this dog, on this lamb, because it was a neighbor nearby. And so I called it Grunt. And of course, the owner of the lamb said, okay, we'll call it Grunt. But we got him to the hospital the next morning, and the nurses said, oh no, we got to call this little lamb Lily, for Easter Lily. That's was really nice that she's gone and did so well. Yeah, I just love to watch her. You know, here she is now 4 days later. You know, so she's getting to be more like a lamb. And I'm having, again, anytime I'm getting one of these movies, there we go. This is actually the chamber at Lake Chatuge. Hilty, you'll be proud that I put this in here for you, because this is a hospital that, again, you got a very forward-thinking veterinarian, Dr. Burr. He's always been forward-thinking. And so here we are. He's a patient in there, and we're at 4.5 PSI. And it's just a phenomenal tool that all of you have in your area that are working at Lake Chatuge or near Lake Chatuge, or the whole entire area of North Georgia Mountain area. It's a fabulous thing to have. And of course, even using it for children with cerebral palsy and the brain injured child, 35,000 children have been helped by these low pressure, mild chambers. Now, if you go on the internet, it'll say, hey, doesn't work. Well, they don't want you to know it works. You know, who's they? Well, the people that have the bigger chambers, one. And of course, I'm not going to talk. My mom told me not to say anything bad about anybody ever, really, ever. So I won't say anything bad about things that are, why aren't this being used more around the country and around the world? It is used in a lot of the countries, and it's one of the prime indications in many countries, but not in the United States. Another addition for wounds is the use in hyperbarics is this little loop that I got on my neck now, and it's turned itself off now, but it's a targeted pulse, very specific electromagnetic field. It's a shortwave radio signal, and it goes to where it goes through the tissues. If you have a bad injury and a bad wound, let's say that may be a bad wound and a head injury on this dog, and so it increases capillary flow, increases oxygenation to that little guy who had a really severe head injury. And so, you know, it can be a cat that's got also been very severely bitten really bad in the head and face. Or again, and if you want to know how it works a little, it works with sending signals, turns on calmodulin calcium, and that causes a constitutive base of nitric oxide synthetase. It regulates, goes up and amplifies it, causes vasodilation, increases tissue oxygenation, and decreases, again, the pro-inflammatory mediators, and it increases the anti-inflammatory mediators, and it's FDA approved for pain and swelling. All right. So this little lamb had it on too. So here's me looking at the little lamb and me looking back at him. You know, I'm in a hospital environment, so I have my masks on and stuff, and because of the COVID. And then here we are. And by the way, this device has been also used as well as hyperbarics for COVID patients as well. And so think about it as a trauma to the brain or spinal cord. It increases the levels of oxygen to those tissues, very much so. And it's sad to me that it's not being used in the mainstream of medicine yet today. And we've got to have them catch up somehow. So every time you think about it, you might even, if you know a physician that does neuro or plastic reconstructive surgery or whatever, tell them about these kind of things. So we have in our body, think about this, 70 trillion cells in a 70 kilogram man. So every one of our kilograms, if our body weight is 1 kilogram, then we've got 1 trillion cells that make up that little cat. Well, let's say, and so that 1 trillion cells, and with each ESO cells has 1 molecular change per cell per second. That's way too fast for enzymes alone. I hope you understand that. Way, way too fast for enzymes alone. Where we work on energy, That's why this works. This is a radio signal, and that's how our bodies work. And so when God made the earth, what did he make first? Genesis 1:3. Light. God said light was good, and it was. First thing he made. If you look at that word in ancient Hebrew, it's R, and it means all the electromagnetic spectrum. The sun and the moon weren't made yet till another day or two afterwards. So watch this. This is a photo mic. Hopefully it's working. Let's see if it works. These are cells dividing. You know, and we have these cells dividing all the time, all the time. This is in slow motion. That's the membrane of the cell. And we looked in school, you'll never see this because it's, you'll just show little drawings, whatever. But every part of that cell is so alive, and it sends out life signaling light. And so I thought you'd like to see that again. I'm going to do it one more time here. That's a cell dividing. And those bubbles are the plasma membrane. And there's dividing. And it's so much energy. 90% of each cell's energy is used to keep those membranes moving in the right precise way. And they come from their mitochondria, which takes oxygen to do that. So oxygen is such a source of needed, you know, it's an element that's so needed. And I'm trying to now move on here. There we go. So this acupuncture, Governor Bessel 26, this is on a sheep that was very sick. And yes, and I've been doing sheep farming work work with my neighbor who raises lots of sheep. And he called me over one night again, and she was having difficulty delivery. And we lost a lamb, unfortunately, but she was very, very sick. She was in shock. She had lost a lot of blood. And so this is her nose, and this is a red light. And that red light is a simple light. It can be very simple. And you can imagine, all you need is, this one just comes from Australia, but it's a simple light. And this one here is, I'm going to shine the light in your here. And this is Governor Bessel 26 right there, right below your nose, right there. And I helped save a man's life one night by just putting a suction tip up into the nose area here of the bridge. And then this is Governor Bessel. This is, a large intestine 11 for pain. And this one here is an acupuncture point, pericardial 6. And you only need to know maybe a half a dozen of these, of where they're at. And of course, you can also direct it right to where the pain is. Let's say I got a headache. And then just move that whole thing into the headache. Well, and if you go to Lowe's or somewhere like Home Depot or whatever, and you buy just a small little light like this, and this is just a little headlight, there's the top of the headlight, and of course, so the other side of that headlight and there we go, is a red light. Just a red light. And you can imagine you can do that same application of that red light then to your nose. And so you have the ability to use it, and it's been shown in really good research that it stimulates acupuncture points far better than a needle does. And you know what? Cats particularly don't like needles stuck in them at all. Imagine that. So yeah, they don't like needles. But if you stuck a needle in this guy, it was really, you know, but now this one here is having some, yeah, he's had head injury. So, okay, so, and you can use it also. We had little, that was not a head injury patient. That was a little kitty that needed to have its lids. We took tissue from the lip and put it up into his eyes to make eyelids. He didn't have any eyelids. Which was kind of an interesting little kitty. So here's a little lamb getting that same red light from Lowe's. And then here's this shows Governor pericardial 6, which is on you, is sitting right about here. And of course, from Stuporus, you go on to help these patients with these type of things that I told you about. So the indications we have, of course, for any wound anywhere, for these simple applications from the light to the targeted pulse electromagnetic field, these are available for you. I would say that you probably should just work with your veterinarian and have them order one for you. And so you'll always have one available, whether it be an abdominal wound, really severe sepsis, spinal cord injury, head injuries, abdominal wounds, necrotic fasciitis. That's where you have a lot of bacteria that are eating away the fascia itself, the deep tissue underneath the skin and covering the muscle in the oral cavity. And of course, the big dog, we call them big dog, little dog bite wounds. And of course, they burns and avulsions and these different kinds of infections, including Lyme disease and fungal diseases. Let's move along then. I think we're about almost to the point where I'm going to have to stop soon, though. This will be our last disease we'll cover tonight. And this is gastric dilatation volvulus. It's a sudden dilation and rotation of the stomach. It leads to life-threatening blockages of blood flow. And of course, and that comes to the stomach, to the spleen, everything. So this rotates to the stomach. And how does this rotate? We really don't understand what all puts it together, but it rotates in such a way that the pylorus comes over itself and it's literally tying that stomach in a knot. And then, of course, as it loses blood supply to the knot, to the stomach. And this is a very intense, this can be a very intense thing. It can happen quickly. So what happens to the dog? These are mostly large dogs, German Shepherds, St. Bernards, Great Danes, but it doesn't necessarily have to be. I've seen them as small as dachshunds. Anything that's more of a deeper chest has more of that possibility. So they're trying to vomit but can't. You can see why. His stomach's rotated over his esophagus. He's drooling and he's having sudden onset. He's anxious and he can't get comfortable. And the abdomen is getting larger and larger. This was first published as a disease in humans in the 1880s, especially as people were getting more sedentary and not moving so well. And then somebody would rotate them in a bed, like say in a nursing situation, and that would help spin that stomach. That's where it was first published. Anyway, they become rather rapidly weak and they're unable to walk, and there's a chronic form of it too, where they're just chronically trying to vomit and they can't, but they're not quite as sick yet. It's because it hasn't rotated so much yet. And of course, the membranes, they're pale mucous membranes, they got a rapid heartbeat, their pulses are fast. And the thing to think about is that the dog's distended, they're distended underneath their chest as well. So here's the dog's front end here, I guess, and here we are. There's the stomach over here. And what we know is that right there would be the ideal place to put the puncture with a needle to decompress the stomach. So here's the stomach that's rotated on itself. So this is like a Popeye sign, they called it. And of course, what you need to do is recognize what's going on, call so they know you're coming, and the hospital's ready for you, and then get there and drive safely. And again, the only time you would do anything other than that would be if you can't make it, there's a big snowstorm, you're stuck, and your dog is dying from his dilated stomach. Then you would poke a couple needles in there, large ones, if you have them, and you would distend the stomach distended out of it. With cows, we've seen the same thing with cows, and the farmers will just use a knife and stick it where that big, large distended area is, but never have a smoking thing going on, because that's methane gas that's in there in the bovine ruminant now, and it's been known to cause explosions. Truly does, can do that. So yeah, make sure there's nobody in the area that's gonna, because that gas gets released, and there's a lot of it. It's like propane inside that stomach of that cow. So we'll usually start then an IV, provide rapid fluid replacement, take an X-ray. You'll see this crazy sign here. Put a couple 14-gauge IV catheters in, and we put those right in the stomach to decompress the stomach. And then we usually then take them to surgery, and we find that often sometimes the spleen is pulled away from the stomach And that also causes bleeding. It can happen. Or this, and the stomach can look as black as that's not very good. And that means that part of that stomach has to be removed. And the spleen can rotate on itself and it loses blood supply, and the stomach can lose its, of course, its blood supply, and then the whole thing is not so good. So you can imagine you have to really move fast. If the delay happens, you must be able to decompress this. So in your first aid kit, I'm recommending that you'd have a couple large 2 to 4 14 gauge IV catheters that you can use to help pop those in through the skin and into the stomach. The prevention is the most important thing, and so we don't know really what causes it, but there's things that would have been talked about, and one of those things is, it's probably make sure that things are planned well in what you're going to feed the dog. Consider a gastropexy whenever you're doing a female dog and spaying the dog, is have that spaying done and open that stomach up in the abdomen a little bit more, and you're going to tack the stomach to the abdominal wall. And now if it's a male dog, same thing. You have to open up the abdomen, maybe with a laparoscope even, and then tack the stomach to the abdominal wall on the right side. And that prevents it from rotating. Always is done, at the time of the surgery. Then we always do this also when we derotate the stomach that has rotated. And then this is a nice looking stomach, so we got to it pretty fast. And this is the abdominal wall, and that's the stomach wall. And we've kind of sutured those together. And of course, we can do it, of course, with other abdominal surgeries if the dog is having something else done and he's a big dog, I'd have this done. So the following things have been shown to help decrease the incidence. Eating 2 or more meals per day. The larger the meal, the larger the amount of food in the stomach, which can rotate the stomach easier. Adding canned food to the diet, having a relaxed, contented, easygoing temperament. I knew one lady who would always feed her dog wine with dinner. I don't know if that really did it or not, but you can imagine feeding a dog with dry food, if you will, maybe calcium-rich meat meal, also been somewhat suggested that these help, with these ingredients there. And then we'll stop right here because we've now reached here about an hour and a half, and I need to be able to let you know that we'll be talking about pancreatitis next time, and then moving on to some other things that will help us in the learning process with, and it may be my last one. I don't know if Hilty knows that, but I'm probably going to just do one more for you all, which will get into some things that are very important related to anaphylaxis or acute allergic responses, the use of the first aid kit and how to make one and what's in it, and that kind of thing as well. And then we'll discuss pancreatitis and that. So I really love you guys. I thank you so much for having a chance to be with you this evening and to teach a little more of what we'll hope to help save our animals' lives. And who knows, it may even help a person too as well. And that's what we're all about, isn't it? All right. God bless you.